Good day everyone, I am Vanna Mariel L. Quinonola and together with here we are again guys to discuss with you guys the clientele and audiences in counseling and the settings, process, methods, and tools in counseling. But first, I'm gonna tackle about the rules and functions of counselors. So, rules and functions. So, rules and function refers to a specific character or position counselors play in the exercises of the professions, while functions refer to the job descriptions or responsibilities and obligations associated with the traits of counselors. So, who are the counselors and their rules? So, first, the counselors. So the counselors are individuals that have been educated and experienced in learning human behavior, and their primary task is to assist individuals who need therapy and achieving an optimum degree of psychosocial functioning through applying ideas learned and over time learning the individual's way of life through counseling. Counselors provide support to clients, partners, friends, and communities who are struggling with mental health and well-being problems. Often, counselors take a holistic approach to their practice using a health model rather than a disease model that emphasizes and supports clients' abilities. So, who are the rules of counselors? So, it might be improve mental well-being by working with people, organizations, and neighborhood, or either encourage clients to talk about their feelings and perceptions, and many more. And aside from that, I have 10 functions of counselors. First is a individual assessment. So, ang individual assessments kay muna ang mga functions sa isa ka counselors they attach sa pag-identify sa mga personal na mga kinahanglanon o mga challenges nga na-experience sa usa ka tawo. This also contains sa pagkabalo sa isa ka personalidad sa isa ka tawo o mga kinaiyahan na kliyente labaw na sa ilang mga ginabati. So they need to be assessed by an individual. So next is ang individual counseling. So ang individual counseling kay isa na siya pud ka process nga giuban sa usa ka kanang licensed counselor diin naghatag og personal nga mga advices sa mga isa ka serbisyo sa isa ka tawo. Kini ang mga nahitabo is pwede siya or mamahimong through personal or online. Since ang individual counseling is mao ang pagtabang sa tao sa pagsulbad sa iyang mga personal nga problema. So, like mga kahadlok o uban pang mga isyu sa ilang kinabuhi. So next kay ang group counseling and audience. Guidance rather. A group of counseling and guidance. This is also way sa paghatag og tabang sa usa ka grupo nga naay mga ginakabalakan in different aspect of their lives. So, this process takes place through sessions where a licensed counselor leads and supervises in a collaborative group. Is a career assistance. So, ang career assistant kay isa siya ka-job nga popular nga pagtabang sa isa ka tao ug to know that kini is makatabang jud siya sa tao. And also diri asad ni nakapaloob like mga career planning, resume building, and ma-improve imong skill development and many more. And next is the placement and follow-up. So, ang placement and follow-up ay kay usa ni siya kabahin sa career services like sa pagtabang sa mga tao ug sa pag-uban sa trabaho like mauna. And ang placement ay sa pagsunod-sunod mga paglantaw or pagsunod mo na follow-up. and sa ilang mga kahimtang human madawat ang trabaho. So next is referral. So referral is a process by which a person is recommended or introduced to another person or agency or organization for the best service or assistance. In the context of career services and counseling, referral can be an important part of helping people to solve their problems or ensure that they receive appropriate support of their lives. So next is consultation, number 7. So consultation is a process where a person turns to a professional knowledge, guidance, and support in solving problems or making decisions. In the context of counseling and professional services, consultation is a way to answer questions, to share challenges, and provide good, accurate information so that they will help by their problems. So next is research. So apply na siya sa functions sa pag-counsel. So research is a systematic process in which information is sought to analyze and interpret to achieve new knowledge and understanding or solving a real issue. So next is, second to the last, is evaluation and accountability. So evaluation and accountability are two parts of process that focuses in judging and checking what is done or done. So lastly is prevention, the number 10. So prevention is a process or strategy that launched to prevent the development or awareness of a bad situation. It refers to avoiding or minimizing or stopping the occurrence of a disaster or a problem. So that's all for my part. And now let's proceed to the competencies of the counselor.
So we are going to talk about competencies of counselors. So what comes in your mind when you hear counselors? Right, it defines with skills, knowledge, and training associated with counseling specialties. Counselor competence involves the quality of provided service and the boundaries or scope professionally activity. Counselors possesses a diverse set of competencies essential for effective and empathic support. Well, firstly, communication skills are paramount. Counselor must adeptly convey information, listen actively, and foster a safe space for open dialogue. Empathy is another crucial competency. Understand resonating with clients' emotion, foster and trust connections. Counselor also need to have excellent interpersonal skills. Clients might feel understood and supported, then a therapeutic connection is formed and rapport is developed. In order to negotiate a variety of backgrounds and respect and value each client's own identity and experiences, counselor must also be culturally competent. So counselors with analytical skills are better able to evaluate cases, spot trends, and create effective solutions. They must be skilled problem solvers who use critical thinking to help clients overcome obstacles. This is entwined with emotional intelligence, which enables counselors to recognize and control their own emotions while also effectively addressing clients. Being conscious of ethics is essential. Counselor uphold confidentiality, integrity, and respect by abiding by professional norms of behavior, while preserving impartiality and identifying one's own prejudice that might influence the counseling process depends on self-awareness. When tailoring therapy approaches to the specific needs to each client, flexibility is essential. Because counseling is an emotionally charged profession, A counselor ability to bounce back from setbacks and manage stress is practically essential. As counseling develops, it becomes increasingly important to learn continuously. Staying current with theories and therapeutic approaches increase efficacy. So counselors are patient and have non-judgmental demeanor. Since every client is unique and growth occurs at a different pace, it is important to create a judgment-free atmosphere that allows clients to explore their emotions without fear. To create a helpful and productive therapeutic environment, counselors integrate technical expertise, emotional intelligence, cultural competencies, and ethical awareness. Their ability to negotiate the intersections of human experiences is made possible by their numerous talents, which help clients on their path to recovery and personal development. So that's all for the competencies of counselors. Thank you.
Hello, my name is Shine Marjeline Hemantisa, and today I will be reporting the areas of specialization and career opportunities of counselors. So, counselors has three main professions, which is we have social work, psychology, and counseling. We are going to focus on our lesson about counseling, but we are going to discuss lightly about social and psychology since it is something that is part of counseling. So the three main profession, one of the three main profession of counseling is we have social work. Social workers focuses on different capacities of therapy depending on their licensure. So kasagaran ani nga mga counselors, social work is kaning naga-counsel sila about sa kaning in regard sa problem sa society. So ang mga counseling ani, ang mga counselors ani naga-counsel sa public, it's either na issue by societal issue, dili gid siya either, since ang ilahang gina-counsel ani is about sa kining issues o kasagaran ani sila naga-advise sa kaning different na kaning perspective sa other people para makahatag pod og kaning sila ang nagasabot sila og kung kaning unsa ang dapat nga maayo sa pagsulbad ana nga kaning problema sa society. So we have also psychology. Sa psychology nagaano siya, so it involves principles and theories from the field of psychology to help individuals navigate and overcome a variety of mental and emotional challenges. Sa psychology, when it comes to counseling, nagagamit sila og kanang mga theories ba kanang og kasagaran pud aning ilahang mga clients kay kana ganing mga naanay mga something silang brain, like we have like kanang mga naay problema sa eating disorder, sa mga depression, sa mga personality disorders. Ang mga ginahandle na sa mga psychologists is kanang naay lala na ba, dili na makayag counseling, dili na makayag storya-storya lang. So kailangan nila og kaning psychologist na naga-provide sa ilaha og kaning research theories. So later matakal na to kung unsa ang main issues sa mga counselors na kasagaran nilang ma-encounter. So we have also counseling, a collaborative effort between the counselor and the client. So ang counseling, we all know naman the definition of counseling na. So let us not further give a more definition sa counseling since my other groupmates will also report what is the definition of counseling. So I am just also giving you the specialized, the counselors where they specialize. So we have family therapy. Under the family therapy, we have child development, adolescent gerontology, or for the adolescents, counselings in adolescents. And for the last part is we have a relationship counseling. So ang sa family therapy, diraan na ma-include ang child development. Ang mga counselors, nag-specialize sila sa kaning pag-develop sa mga childs, like it's either kaning kailangan og counseling ang child, kailangan niya og kanang one-on-one na kaning pakipagstorya sa counselors if naaba siya issues or kanang naaba siya confusing na mga kaning life choices. So kailangan niya counselors. And for also, we also have adolescent. There as adolescents na ay natay ginatawagan na ganing nagkalisod na kung unsa ang pilion nga life choices, lifestyle. So some adolescents needs counseling, and counselors are there to provide a different perspectives to not just suggest but to advise also for their dilemma. Also, important notice, ang counselors, they do not fix the issue. They only give advice to give a new perspective to the client. So we have gerontology for the adolescents. Counselors also specialize about the adolescents when they need counseling. Kasagaran aning kapag maadto gani ka sa kaning the aged dira ana nga field, na kay makita dito ang counselors na naga-counsel sa mga adolescents, and sa mga kaning old aged na. So ang kaning mga counselors dito na naga-counsel sa mga oldies it is unique since naaman sila kaning different gani nga capacity, except like kanang mag-counsel nila kung unsa ang ilahang problema ba kasagaran dito sa counseling. It's either one-on-one or group. Later ma-discuss na to kung unsa ang kaning ang size sa counseling. So we also have relationship counseling. Ang relationship counseling naapod na siya marital counseling, since ang nagakasagaran counseling ana is kanang mga kaning mag-uyab, mag-asawa o kaning magpakasal pa lang. Og ang kaning mga counselors naa sila dira para mag-provide og kaning maminaw sa ilang problema. If naabay issues unsay dapat na kaning himuon, unsay dapat na kaning ihatag nga advice para sa mga client. Og kung tama bang ilahang choices, maghatag sila ing ana ba, naghatag gani sila different perspective kay para pod matagaan og other na pod na kaning pagsabot ang clients. For health counseling, we have mental and physical health. Since duha lang na ang naadira sa counselings, naga-specialize ang counselors ana. Ang mental health, since when in regards sa kaning psychology sa kaganihan nga akong gidiscuss, we tackle that psychology is kaning nagabase siya sa mga theories sa mga kaning human behavior, human studies, right? So diri sa pag ang mga counselors nagaano pud sila, naga-specialize pud sila sa mental health using psychology. Counselors also gave a new perspective to their clients because ang mga kasagaran man gud na adiri sa mental health is kaning magpatabang ba sa counselors, magapa-counsel about their depression, about their personality disorder, anything basta kaning mga gani like kanang nanay problem sa ilahang sarili nila or sa ilahang mental health. So kailangan nila magpa-counsel para mabalaan pud nila og kung unsa na ang kabalo, unsa na ang naa sa ilahang, unsa na ang state sa ilang mental health ba. And counselors were specialized in that field. So next we have physical health. Sa physical health we have diri sa physical health kay kaning naadira ang ganing na ay clinical backgrounds na mga counselors. So kaning mga mga clinical backgrounds, educational clinical backgrounds na counselors, they provide a new perspective. So when it comes to mental and physical, dako gyud siya difference, since ang physical naghatag siya og kaning about sa physical na well-being sa client, like for example if the client is overweight or it has diabetes or kaning naa gani sila cardiovascular, sila ang naga-identify og nagahatag og advice as to what is right or wrong, unsa ang tama ug mali nga himuon. So counselors specialize in that two fields. So, we also have business industrial counseling. Ang nagapa-counsel ani is usually kaning large nga group na ba ng mga organizations like nga na kaning mga business counseling o kaning employee counseling. Usually ang naga-focus ani sa naga-specialize ang counselors ani is about ganing sa kanang magapahatag sila og advice sa ilahang business or like kanang sa kaning mga employees if naay something nga kaning dilemma nga kaning ma-encounter sa employees which endangers their prospective works. So they need counseling and counselors are there para muhatag og bagong perspectives. Also, counselors specialized in addictions and behavioral therapy. We have substance addiction counseling and behavior counseling. Sa addiction and behavior therapy, ang example ng substance kay kanang mga drugs o kanang mga alcohols na kaning mga addictions, nagapa-counsel po na sila and counselors are giving the advice for the clients na kaning as to what is the proper way na kanang i-control ang ilang addiction. So, we also have behavior counseling. Sa behavior counseling is nagapa-counsel na usually dira ang kanaganing similar siya sa mental health counseling pero ang sa behavior only focuses on the behavior kasagaran na naga-collage ang mga psychiatrists nag-merge ang mga psychiatrist o ang mga mental health counselors so kaning mga behavior counseling to conduct a research about the human brain. Also, we have other specialized counseling. We have phobia, bereavement, and interpersonal and intrapersonal counseling. When we say kaning other specialized counseling, counselors also specialize not just kaning major problem but specialize po sila sa kaning mga like kaning individual problems like kaning kung tahay ang kaning tao naka-experience siya traumatizing nga kaning event sa iyang kinabuhi and counselors were specialized to identify what phobia or what fear did the human acquire. We also have bereavement, the loss, the pain of losing someone, and also the interpersonal and intrapersonal counseling, which as the counselors knows how or when or what their clients feel, and the counselors were there para mag-advise as to what really is their problem, is the client's problems. Also, we have the counselor's career opportunities. So, if you are interested in about the career opportunities for the counselors, we have clinical supervision, specialist counselor, group counselor, career counselor, industrial counselor, counseling psychologist, clinical social worker, community-based counselor, correctional counselors, educational counselor, addictions and behavioral counselors, marriage and family counselors, and training program coordinator. So, daghan kag options when it comes to counseling. So, if you were interested in studying about or like kaning mag-eskwela about sa course ng counseling or pwede kayo makaanani. So, next.
A pleasant day. My name is Sydney Salipod, one of the reporters under the topic of Week 4 and 5 in Diass. To continue the discussion in line with counseling, I will discuss about the rights, responsibilities, and accountabilities of counselors. The Philippine Guidance and Counseling Association Incorporated, or PGCAS, is the primary institution regulated by the Professional Regulation Commission, or PRC, to oversee the ethical practice of counseling in our country. So, Ang kaning Philippine Guidance and Counseling Association Incorporated, it is an organization, a legal organization that is related, or they are this organization is the one who handles the counseling in the Philippines. The PGC's main role, ilahang role is to ensure that the practice of counseling adheres to the highest ethical standards. So, ang ilahang goal is kanang ang counseling man is nag-involve man na siya og mga persons. Of course, ang counseling involved na siya og person kay counseling is about guidance, right? Ganon siya in order nga mag-guide mo ang isa ka person nga naay gina face nga problem in life, or not only problem kanang guidance lang in order nga mabalik ang life, or mabalik ang life in line sa kung unsa jud dapat ang angay sa usa ka tawo. The practice of counseling adheres to the highest ethical standards. They set guidelines and standards that all counselors in our country must follow. So, nag-set sila og mga standards that nga dapat mga counselors sa ang country kay masunod pud siya. If a counselor fails, kung tahay ma-fail ang counselor to uphold the standards, the PGCA can take disciplinary action against them. So, PGCA is also in charge para mag-uphold, or kanang sila pud ang na-assign para sa kanang to take something like sila ang mag-assign, or sila ang responsible para sila ang responsible if a counselor fails to uphold these standards. So, sila man ang naggunit sa mga counselors here in our country, the PGCA. They are also they're responsible for the counselors. Responsible for counselors. This to ensure that individuals seeking counseling services are protected and receive the highest quality of care. So, in the practice of counseling, before mag-serve in the country, or mahimong before siya mo proceed as in mag-serve siya as a counselor in the society, or mag-serve siya as a counselor, kailangan, beginning the counselors are required to pass the board exam. They need to pass the board exam in order for them to serve as a counselor. It is important, like the other professionals, like teachers, nurses, engineers, etc. Beginning counselors are required to pass the board exam administered by the PRC before they can offer guidance and counseling services. And there are two important documents that stipulates the rights, responsibilities, and accountabilities of Filipino counselors, which are Guidance and Counseling Act of 2004 and Code of Manual of Technical Standards for Registered and Licensed Guidance. These two important documents is very important as a counselor before sila mag-serve, kay dili basta-basta ang counseling, because you are handling a person. You are handling a person and you are guiding a person. Dili siya basta-basta, because counseling has a big effect on a person's life. And it is important for any professional organization to cite specific rights of its members, and these rights protects them from any untoward legal or ethical issues that may or they might encounter in their practices. So, let's proceed to the rights of counselors. In the context of, the first one, right to privileged communication. The counselor is allowed, under law, to refuse to release any statement, conversation, file, or information that is acquired while counseling a client. So, ang pasabot ani aning right to privileged communication, that in the context of counseling, privileged communication means that anything a client says to their counselor during their counseling session is confidential. So, This includes any statements, conversations, files, or information that the counselor acquires during the course of their work with the client. So, a counselor has the right na dili siya mo ingon, na dili siya mo storya kung unsa ang gilang hisgutan sa iyahang counseling. Dili naa siya right nga dili siya mo istorya, naa siya right na dili mo ingon kung unsa ilahang istoryahan sa iyahang gi-counsel. Naa siya right nga mahimong confidential ang ilahang giistoryahan duha. This includes any statements or conversation, lang itong istoryahan, file, or information that the counselor acquires during the course of work with the client. Under this principle, legally allowed to refuse to release or disclose any of this information even in court law. So, the next is right to practice in the country. If a counselor has satisfied the minimum requirements for practicing professionally, for practicing in the country, then he or she is able to enjoy work-related privileges that are mandated by the law. So, pasabot ani, a counselor has also a right na siya'y karapatan na mag-serve or manalbaho as a counselor sa country. In essence, the right to practice in the country is a recognition of counselors' qualification and competence, allowing them to legally offer their services and enjoy the professional privileges that come with their license. Another right for rights of counselors is the right to continuing activities for counselor care. The professional organization may offer various continuing activities to its members, such as seminars and training, administrative opportunities, and research-related activities. Meaning, ang mga counselors, they also have the rights na dagdagan ang ilahang knowledge in counseling, such as seminars and training, and mga administrative opportunities and research-related activities in order for them to improve their counseling and mag-widen pa ang ilahang knowledge para mas masabtan nila ang ilahang patient or ang ilahang i-counsel. The next rights of counselors is the right to rehabilitation services. This means that counselors who experience work-related stress have the right to seek rehabilitation and psychological support from other mental health professionals. So, pasabot po ani, dili lang kay ang mga tao, dili lang kay ang ubang tao po, ang naalang, ang pwede lang ang magpa-counsel. Ang mga counselors po, dapat sila rights para magpa-counsel or mag-seek og help sa other counselors in order for them nga matarong ang ilahang mental health and masakto na po sila and naa sila may istoryahan sa ilahang feelings kung unsa man ilahang gibati in order for them to work better. Yes, isa na sa mga rights sa counselors. Another right of a counselor is the right to safety and dignity. Much like other clients, counselors also have the right to a safe and dignified practice. This is especially important when seeing clients who are at risk of harming others or being exposed to cases with high security and safety risk. Meaning, when counselors work with clients who may pose risk or of harming themselves or others when they encounter cases with high security and safety risks, it becomes even more important to ensure their safety and well-being. To protect the safety of others, certain measures can be put in place. This may include establishing protocols for risk assessment and management, providing training on handling potentially dangerous situations, and implementing security measures within counseling settings. Counselors may also have access to support systems such as supervision or consultation to help them navigate challenging cases and ensure their safety. So, a counselor also has the right na mga yuog security and in order for his or her safety, lalo na if ang iyang patient daw or ang iyang i-counsel kay kanang ano gani is at risk of harming themselves or others. Kaya may mga ubang cases na yung anak na jud ang mga patients or ang mga counselee na kailangan i-counsel sa mga counselors na lahi na o kanang attitude and kanang dili lang sa mind lang siya nga problem. It means nga niduwas na jud siya as in na jud siya physical nga work results sa iyahang problems. Now, moving on to the responsibilities of counselors. First one is no. A counselors attend to several important responsibilities, and counselors are mandated by their code of ethics to foster safe and professional counseling relationships with their clients. So, counselors prioritize creating safe and professional relationships with clients such as mandated by their code of ethics. And this involves establishing an environment where clients feel secure, sharing personal information, ensuring confidentiality, and maintaining ethical boundaries to foster a trusting therapeutic alliance. And also part of the responsibilities of counselors are must limit their practice to their educational background and professional competence. And counselors should engage in research oriented activities to improve their knowledge of their practice. And counselors must uphold ethical values throughout their professional relationships with clients. And another responsibilities of counselors, they must recognize and respect their clients. That is very important. Pinaka-importante jud as a counselor. Recognize and respect their clients' religion, race, age, ethnicity, educational background, socioeconomic status, and social demographic characteristics. We all the counselors, the one of the counselor's responsibilities is they need responsibilidad sa mga counselor ang i-recognize ug i-respect ang race, ang religion, ang age, ang ethnicity, educational background sa ilahang counsel, sa ilahang patient. Responsibilidad nila na ilahan ang i-respect. And the counselors must maintain good and functional professional relationship with their clients and uphold ethical principles of respect, confidentiality, informed consent, and safety security. The counselors are accountable for specific tasks and responsibilities that go beyond their counseling sessions with clients. Being accountable means being answerable to their actions. It is important to learn that while responsibilities can be shared, accountability cannot. So it is very important sa usa ka counselor ang pag-value nila o ang pag-practice nila sa ilang responsibilities as a counselor in order for them na mas maayo ang ilang relationship sa ilang counselee, sa ilang i-counsel, and mas kay kung namo go responsibilities ang mga counselors, mas ma-build nila ang trust sa ilang i-counsel, and they are more professional jud sa ilang profession. Kay ang counseling, it is very anong gula siya good word, sensitive po siya kay you are talking or you are guiding. Your job is to guide, to fix the person's life or to guide them back in their life na ayuhon nimo or mas tabangan nimo sila or i-guide nimo sila sa ilang life. No? Ingana man doon ang trabaho sa counselors. That's how important sa ang ilang responsibilities. Moving on to the accountabilities of the counselors. Counselors are required to engage in continuing professional development in order to maintain their capacities as counselors and continuing practicing their profession. So, isa sa part sa mga accountability sa counselors, they are required and they must engage in continuing professional development. Professional development in order for them na i-improve ilang self o maghatag sila better quality of service sa ilahang i-counsel. And counselors maintain and safely keep their clients record. It is appeal po ni siya sa accountabilities. And they are also responsible for granting clients access to this. Counselors avoid or multiple relationships with their clients. For example, having a friend or a relative as a client can risk potential issues and bias in the outcome of the counseling process. So, ang mga counselors ina-avoid nila mag-counsel o kanang clients nila ma-client nila ang ilang friend or ilang relative because there is a big possibility na ang outcome or ang imuhang ma-advise imuhang client is more like ang answers o ang outcomes kay naay bias siya nga pagka-istorya and apila siya sa accountabilities of a counselor na dili siya if that client is your friend or your relative, well, dili siya angay or dili siya pwede for my own understanding na dili siya pwede kay possible na mag-result siya og bias na bias na outcome sa counseling process. And counselors are responsible for ensuring that all equipment to be used in counseling, especially computers and data banks, are adequately secured to ensure that clients' privacy and safety. So, appeal po sa accountability sa mga counselors ang pag-ensure silang mga equipment in order for them to protect and to respect their clients' privacy. Diba? Kay confidential man ang ginaistoryahan sa counseling. Yes. Another, counselors are liable to any form of unethical practice that goes against the code of ethics and other pertinent laws in the Philippines. Counselors also tasked to ensure that all procedures and activities conducted are relevant in their field of practice. So, pilpon sila ang accountabilities na gina-ensure sa mga counselors na ang ilahang mga procedures, mga activities na ilang ginakandak sa ilahang counseling kay relevant siya sa ilahang field of practice. Kanang ilang mga procedures o mga activities na relevant siya, ma-relate niya po siya, dili siya mulahi. Dili man po pwede nga ang mga activities o mga procedures kung isa ka counselor kay dili siya ma-relate sa imuhang dili siya ma-relate sa imuhang field, sa imong expertise, diba? And another, counselors are expected to ensure that all information promulgated in any aspect of their practices, of their practice, example, advertising materials, is true and accurate. Expected po sila nga kung maghatag nun sila og information nga related sa ilang practice, ginasure po nila, apil silang accountability na dapat sure na siya, tinuod na ilang gihatag information o accurate na siya, tinuod. And reliable. Hindi mo po pwede na magpataka lang ka o butang mo magmahatag ang information. Diba? And last, sa accountabilities, counselors should report any prevailing ethical and professional concerns to the official administrative body and regulatory boards responsible for maintaining ethical and professional standards in the field. So, isa po sa accountabilities sa mga counselors, kay they should report any prevailing ethical or mga kanang nisway or nilihis ni kontra sa ethical and professional concerns to the official administrative body and regulatory boards responsible for maintaining ethical and professional standards in the field. Counselors should maintain and they should maintain their ethical and professional standards in the field. So that's all. That is all the rights, responsibilities, and accountabilities of a counselor. Goodbye. Thank you.
Good day everyone, I am Cassandra Diokba and for today's video, we'll be tackling about codes and ethics for counselors. All professional practice in applied social sciences, counselor must observe confidentiality at all times. Without confidentiality, clients cannot trust the counselors and therefore make the profession impossible to practice. So, counselor dapat is nag-observe or nag-follow sa confidentiality all the time. Kay if wala ning confidentiality, ang clients kay wala sila salig sa counselors and then ang kaning profession is impossible na mag-practice or imposible nga maghimong successful ang inyong counseling. Also, if ikaw ang counselor, dapat na po kay i-avoid nimo ang pagiging chismosa, dapat avoid nimo ang pagiging bias, and prevent ka ng like pagiging judgmental. Since kana dapat nga mga attitude is if you are a counselor, dili na siya dapat nimo ginadala or gina-apply sa kana nga trabaho kay kanang counseling is very kanang confidential and then kung naay mga ganing mga privacy nga kanang mga storya nga kanang privacy na jud kayo nga dapat dili vulgar, dapat ikaw counselor dili nimo i-share jud nga dapat dili nimo ipangkalat-kalat sa akong gipaingon sa imong clients kay if imuha na siyang ikalat or kanang ipanabi or chismis sa lain nga kanang siya kanana kay ikaw counselor kay posibilidad ka na mukaan og kanang license kanang pwede mo ka mawala ng trabaho. And if you're a counselor, dapat ka nang careful dyan ka sa imong mga words and then you should uphold the high moral standards at all the time. And then the next slide is the 4 ethical principles that subsume a number of specific ethical standards. First is the respect the rights and dignity of the client. Guidance counselor honor and promote the fundamental rights, moral and cultural values, dignity and worth for clients. They respect clients for privacy, confidentiality, self-determination, and autonomy consistent with the law. So, if you are a counselor, you should respect the rights and dignity of your client. Kailangan po ikaw nga counselor aware ka sa limitation para dili na ka mag-over na gani and kanang mga procedures na imuhang gina apply or kanang diba in counseling they have a lot of procedures na buhaton dapat sa imong mga procedures na ginabuhat dapat pud sang ayon pud si client or kanang okay sa iyaha. And then next is competence. Guidance counselors maintain and update their professional skills. They recognize the limits of their expertise, engage in self-care, and seek support and supervision maintain the standard of work. So, sa diri nga principle is ikaw dapat nga kanang guidance counselor is dapat dili ka mag-stop. You should never stop engaging and acquiring new knowledge in your field or profession. Diba? As we observe kanang daghan mo jud mga changes na nahitabo karon murag every month or every year man jud mga changes. So daghan na po mga changes na wala nimo na natun-an or kanang murag wala na po ka nakabalo. So ikaw nga counselor you should kanang embrace changes and learning new approaches as a part of social counseling. And then kanang ikaw pod nga counselor dapat kanang dili ka tapulan og kana ganing attend og mga meetings, seminars, kanang mga trainings kay drama gud mo maka-learn ka nga kanang mas ma-improve ang imong mga skills para sa katong mga bag-o mga changes karon. And then through that training, kanang meetings, seminars kay mas magiging expert pa ka sa imong field or kana sa imong profession as a counselor. Next is the responsibility. Guidance counselors are aware of their professional responsibility to act trustworthy, reputable, and accountable manner toward clients and the community in which they work or live. So, kailangan ikaw counselor dapat responsibility to act trustworthy. Kailangan makasaligan ka sa imong client. Kaya if dili ka makasaligan sa imong client, wala po saligan imong client, di ba? Mag-alangan din imong client. So, ikaw po, guidance counselor, dapat kabalo ka sa imong function o sa imong role or duty as a counselors. Sa counselor, important ang imuhang reputation, image counselor, and ang imuhang mga image as a counselor is nag-depends po sa imuhang performance, diba, as a counselors. And then, it is important that your company trusts you or your client trusts you so that kanang everywhere you go gani kanang like murag daghan mag-recommend sa imo nga kana siya kay good na siya, how na siya mo counsel. So kana kay daghan mag-recommend sa imo ha kay masaligan ka, trustworthy ka, and reputable and accountable matters toward client. And then because of your good performance, mas effective ang imuhang counseling, ba? If kanang isa man jud sa kanang murag attitude or kanang murag dapat na good for accuracy sa bana siya principal jud sa counselor is kanang trustworthy ka kay para kanang kung masaligan ka ma-feel good sa imuhang client nga kanang kanang safe gay sila sa ilang mga gipang ingon kay safe sila nga kanang dili to ingon sa akong client kanang amo-amo lang jud to ana good kanang feel kay sa ay ma-feel jud sa imong client nga kanang safety kay ilahang mga kanang secrets o privacy o mga problems nila nga dili nila gusto mabulgar sa laing tao. So if you are a counselor, dapat ka ng trustworthy, dapat makasaligan jud ka, and mura siya. And then principle 4 is the integrity. Guidance counselors seek to promote integrity to their practice. They represent themselves accurately and treat others honestly, straightforwardness, and fairness. So, kaning principle is one of the crucial principles of kanang counselor, diba? Since it is a principle why client have a trust on you, and then in these principles you have to be honest, and you have dapat kanang nakay high principle if kanang ato situation na if kanang unsa ganito ang imuhang promise sa client kunwari kanang ako ang counselors tas na nagpakon sa kuha na ako client tas ang client is kanang nagstorya mi about kanang privacy na jud gani kanang like confidential lang kayo para mabalaan, diba? So ang gusto ni client is kanang dili lang ipasabat, dapat sa inyo lang jud duha, dapat kamo lang jud ang makabalo. So ikaw nagpromise ka nga imuha jung dili nimo isaba sa tanan. So biskan pag kana ganing naimota na kanang nay mga yung info, even though kanang imong friend, imong mga kanang mga kaila or closest kayo ninyo, dili jud dapat imo isaba kay since nagpromise mo ka sa imong client lamang kay kanang tawag na honesty, kailangan jud mo tapuran to ang imong promise sa iya ha. And then kanang we all know as a counselors ang life sa life sa imong client is one of the confidential, and then kanang pinaka kanang like gina cover jud nimo na para dili jud mabulgar.
Hello, once again, my name is Shine Marjeline Hemantisa and I will be reporting characteristics and needs of cliente and audiences. So, let's go! Counseling is a dynamic, purposeful relationship between two people, counselor and individual client. They aims to develop the individual into a distinct personality. So, brief discussion about the counselor and the individual. Ang counselor, kay naa siya professional background which helps the client or the individual client to have a to develop a distinct personality. So, common problems of counselor is resistance to counseling. So, the individuals, naa sila'y mga tao, naa sila'y mga counselors, na sila'y ma-encounter ba, na kanang individuals, na kanang resist gani sila sa counselings, like, they feel like the feeling of not needing a counseling or special help, like, dili nila feel na kaning need nila og counselor since they think they can handle their pain on their own. And the counselors also, so balik ta sa kanang the feeling of not needing the counselor's help. Ang kasagaran nga na-encounter sa mga counselor about ani sa resistance nila sa mga clients is that gani murag ma-feel nila nga ma-downgrade ang ilahang sarili if magpa-counsel sila. Na sila kaning negative perspective about counseling ba. They do not view counseling as something that helps their well-being. They view it like something na kapag magpa-counseling na ka, you're, kanang like, dako na kayang problema nimo sa kalibutan, or murag dili nimo makaya, so kailangan mo magpa-counseling. That's not true, but the counselors are a professional which they deal it with a professional kaning ginadeal po dila na mga yung nga tao with a professional way, on their own professional way. So kanipong from the faculty itself na pod ni naga-resist pod gani, like kaning naay mga when we say faculty, ang ginapasabot na ko ani kay kaning like for example sa school kaning ang ginapasabot na ko aning faculty is for example na ko batang na ko ni sa isa ka situation. Kung tahay sa isa ka classroom na ay isa ka estudyante dito ang nagasuffer og mental health, nagasuffer siya, kato siya nga student, kailangan niya og counseling, but her teacher kay gina-disregard gani, like dili siya gina-disregard gani, like don't feel the need of counseling, like gina-think atong teacher ba na that's a strong student, makaya niya na. So, ang kaning common po na gina-encounter sa mga counselors kay kanang gikan gyud sa faculty or kaning ang environment or ang kaning surroundings na gyud ang problems, dili ang kaning client. So, murag na ay resistance nga mahitabo tungod ana nga situation. Next, we also have individuals from different cultures. Na ay mga pasyente, ang mga counselors nga naa sila'y different sets of values and cultures. So, magkaaway-away na ba? Kung tayo sa isa ka grupo, na ikuan dito. Let's talk about race. Okay, example lang. For example, individuals dito, na ay friends dito nga, kaning she is from China and China has different cultures and traditions, and I am from Philippines. Naami kaning conflict nga mahitabo ba, so, kay tungod lagi lahi mi og values and cultures. But then again, ang counselor is from America. Since lahi-lahi man may culture na ay kaning difficulty sa among pagstoryahanay tulo ba. Nagdili ganing magkasinabot since naami lahi-lahi nga kaning pagtinuuhan, naami lahi-lahi nga kaning pagtuo. Next, we have individuals with strong emotions. Emotions that come across the individuals. When we say na ang kaning common problem sa counselors na ma-encounters is kaning ang kaning emotional nga pasyente, I mean, being emotional in counseling is normal. So, it is common for the counselors to encounter the individuals with strong emotions. Siguro ang one of the research na nakita nako is ang pinakalisod ani nga ma-encounter sa counselors is kana ganing individuals na kanang naa sila'y like kaning actions, rough actions na mahitabo, like kapag emotional sila. When I say rough emotion actions, rough actions is kana ganing mag-wild, for example, tungod kay ganing dili nam nila makaya, and that is common for counselors to encounter that way. Next, we have client tele based on the size. So, last na ako nga discussion, nag-ingon ko, di ba, sa inyo nga ma-encounter nata ang counseling based on size. So, ato na ni siyang i-discuss. So, clientele based on size. We have individual counseling. It involves a one-on-one therapeutic relationship between the counselor and the client. It allows for a personalized and focused exploration of the client's concerns, feelings, and goals. Usually, ang kaning mga individual counseling na kay one-on-one na sila sa kaning counselors gani. Naa sila like kaning istoryahan nga kaning sa ilaha, sila lang duha makabalo. And kanang sa kaning individual counseling, they kanang kapag magpa-schedule na ang kaning mga clients sa mga counselors, they need a very comfortable place where they feel comfortable para magawas nila ang ilahang hinaing or ang ilahang dilema, na which it results to something na kaning makahatag og honesty sa clients. Ang individual counseling kay kaning ang gyud ang mga concerns kasagaran ana kay kaning ilahag yung sarili. They're not focusing on not focusing on others. Kaning ang main problem is within themselves. Next, we also have group counseling. So, ang group counseling, it has a group structure and group composition. Group counseling is a form of therapy for small groups of clients that interact to share problems with each other. It has a group structure, which is ang group structure kay numbers of sessions, length of sessions of scheduling. Sa group structure, sa group counseling kay nang usually nagapa-counsel is kani it consists of 6 to 8 hours kapag magpa-counseling sila, and the length of sessions depends on how flexible the times of the counselors and the clients' schedules. Ang kaning scheduling, when we say scheduling, is kanang magpa-schedule sila mismo sa counselors directly kay para ma-fix ang time, ang schedule sa counselors, so matagaan sila og time. So, for the group composition, we have heterogeneous groups and homogeneous group, and we also have group size. So, for the group composition, heterogeneous groups, ang kasagaran aning heterogeneous groups kay kanang mga grupo gani nga kaning na sila'y different na problema, na sila'y different na kanang issues and problems. So, ang pagkasinabdanay ana is dugay ma-conclude and conclusion. So, ang homogeneous groups, kay kanipuning grupo, nga kaning parehas lang sila situation, parehas lang sila problem, related lang ang ilang mga issues. So, ang results, ana, kay kanang naa sila'y dali or paspas nga pagkasinabtanay. O ang ilang flow, ana sa counseling is kaning swift depends sa sinabtanay sa kaning mga kliyente. And for the group size, consist usually a group size usually consists of 4 to 10 participants, depends on how they occupy the space around the counselor space. Each group counseling has a professional trained counselor that acts as a facilitator. So ang kaning counselor, siya ang naga-organize ba or naga-storya sa mga sa grupo. Siya ang murag soul na kaning manager sa kaning counseling. Siya ang like kanang naga-fix o kaning schedules, for examples, or like siya ang nag-talk, siya ang main na magkuan ba. Sa ihatag na to sa isa ka example, like for example ng counseling kay ibutang na to siya mura ganig meeting sa mga taong na kasakit sa kasikasing. Ibutang na to siya nga kaning counseling, nagpa-counsel sila kay parehas sila og ay kay mga homogeneous group sila na sila kaning same na kaning pinagdadaanan. Og ang kining sa isa ka grupo na agyo na mag-facilitate na ang mag-ingon na, oh, ikaw, sa mga problema nimo. Mao ba? Ingani po di baya ang problema. So, ingani baya ing ana. So, wala siyang facilitator. Next, we also have the community counseling. Aims to restore the order and the harmony of the society. We have a type of counseling that is used to help communicates that are suffering from psychological or social discord. Ang community counseling diri ana magkani ang ilahang napud na siya'y related na kaning work sa social workers. Ang tawag ng mga social workers na counselors is a community counselors. And ang kaning ilahang goal ana is kaning maghatag gani og kaning order sa society or kaning pag fix sa society, sa issue sa society, o kaning nga counseling kay kanang naga-focus siya sa individual sa community. So community is something na kaning na buo because of the people. O kadong people naga-focus ang counselors ato na nagapa-counsel ang community para sa individuals dito sa community. And they either suffer from psychological or social discord, and the purpose of community counselor is there kay para ma-fix ug mahatag og bag-ong perspective ang mga counselors. We have organizational counseling, an effective and preventive people management strategy for organizations, so usually to help employees better managing stress, personal issues, or work-related problems. Organizational counseling also has the 3 types. We have directive counseling, non-directive counseling, and participative counseling. So, ang kaning organizational counseling, ang ingon ako sa kaganing halas na ako na-tackle nga ako gyapon nag-report is ang kaning organizational counseling is usually ana ang kanang mga company nagapa-counseling. They want to something, it's either ang kaning ilahang mga facilitators sa isa ka organization kay like naaga face of difficulty or na sila face na difficulties regarding sa lahang business. And organizational counseling is a strategy kay para ang kaning mga workers sa isa ka organization kay mahataggan pod og reassurance para pod malesen ang ilahang stress gamay, dili lang gamay. So ang kaning directive counseling is okay, balik ta. So, ang kaning directive counseling kay ang mauna siya dira ang ganing facilitate sa isa ka organization counseling. Like for example, magsugod na ang counseling. Ang sa directive counseling mag-focus siya sa individuals nga present sa counseling. Kung tahay na ay worker didto ang kaning stress nagnawong so gidto ulan niya. Participative ang kuan ba? Active ang kaning counselor ba? Kapag moingon tag directive counseling. kana ganing mag-focus pud siya mismo sa kaning individuals gyud na present sa counseling ay sa sa place sa counseling. Mag-focus gyud siya mismo sa iyang clients. So ang kaning directive counseling kay naghatag pud siya og kanang directive na kaning solution para sa iyang mga clients individually. So ang kaning non-directive counseling mag-storya po ko about sa directive counseling, which is ang directive counseling ang advantage is mas confident pa ang counselors, syempre daghang tao. So ang sa directive counseling ang advantage is mas confident pa ang kaning counselors because of the situation or the circumstances o kaning ang counselors pod ang focus sa counseling since siya lang ang kaning authority sa kaning isa surrounding area ba. So naa siya confidence ang counselors tungod sa ihang authority nga na-handle og ang kana ganing makahatag siya og proper guidelines sa iyang mga clients. So kanang active manggod siya, so naga-focus siya mismo sa iyang mga kliyente. Balik na ta sa non-directive counseling. Non-directive counseling is about kanang sa. So, ang kaning non-directive counseling, base sa ako research, is ang kaning non-directive counseling kanang different siya sa directive counseling when in terms of sa kaning isa ka surroundings. When sa directive counseling na ay authority ang kaning counselors, pag abot sa non-directive, kay ang kliyente ang naay authority since ang kliyente na siya kakayahan ng kaning mag-decide para sa iyang sarili o dili ang kaning counselor o ang kaning sa non-directive pod kay kaning maka-express gani ang kaning mga counselor mga clients maka-express sa mga clients sa ilahang mga kaning mga kasakit since ang kaning mga counselors man ang wala naggunit sa kaning authority. For the participative counseling, we have ang balik na sa ang kaning participative counseling kay ano na ni siya sa middle sa middle sa direct ug sa non-directive since ang kaning participative kay mao na naman ni diri ang kaning maka-interact na ang kliyente ug ang kaning counselor ba nang nanagani sila same na authority sa surroundings o sa kaning maka-interact na sila, magkastoryahanay na sila face to face o kanang ang kaning organization na mismo ang kaning magkipagstorya sa kaning counselor o ang counselor na po'y makipag-talk sa kaning mga kliyente. Next, we have clientele based on characteristics. Okay. Clientele based on characteristics people with substance abuse, women, members of LGBTQ, victims of abuse, the homeless, people with PWDs, people living with HIV or AIDS. So, ang kaning mga clients base sa ilang mga characteristics na ay people with substance abuse. Ang kaning kini siya nga client, ang characteristic ani nga kliyente kay ano siya naa siya drug addiction, alcohol addiction or kaning na substance abuse ba kanang naas ginaaboso na nila ang ilang kakayahan na mag-inom or magsigarilyo pa na or kaning mag-take og drugs. So it is also one of the characteristics of clientele. So ako siyang gi-include sa akong PPT, sa akong discussion. Women nang ang kasagaran majority gyud nagapa counseling sa mga counselors is kaning mga women. So we also have that thought na ang kaning woman ang kasagaran naka-experience og sexual harassment, right? I mean, naamay kaning na may lalaki nga maka-experience sa ganing sexual harassment but in major basis sa society ang woman kasagaran. So kaning isa sila sa characteristics as a clients. Since kanina ano po sila ba nahati ang ilang issues mainly because of their gender. When we say gender, we also have members of LGBTQ. Diri ang mga kaning marginalized na gani. Like when we say marginalized kanang nadawat na society, nasa society as norms gani. So when we say kaning ang isa sa clients sa counseling kay mga members sa LGBTQ, it's because LGBTQ members experience the marginalization of the society of the unacceptance sa society about sa ilang gender. So they're characterized as a new client na kaning sa counseling. Next, we also have victims of abuse. Kasagaran diyan na yung mga bata, mga tiguang, yung mga mama, mga mag-asawa. Ang mga victims of abuse is also one of the characteristics because they suffer mentally and physically because of the specific circumstances or issue. We also have the homeless. When we say the homeless, kay kanang mga tao nga kaning wala sila'y matulugan properly. So, it is also based of counseling. Ang kasagaran ani nga kaning maka-appeal sa counseling sa mga homeless kay kapag magpa-community counseling. So, isa sila sa characteristics sa clients sa mga kliyente. Hey. So, nibalik ta no? Sorry about that. So, naana ta diri sa people with PWDs, mga people nga kaning naay disabilities. It's either inborn or because of circumstances. Kanang mga people nga naay disabilities na kaning naka-feel sila nga ng kaning dili na lagi end na murag nanay different siya sa ilahang murag dili na complete ang ilang kinabuhi kasagaran diri ang maka-feel na sila depressed tungod kay dili na kompleto ilahang kinabuhi because naa na sila yung mga circumstances nga dili na nila mahimo tong mga butang mga kasagaran sa mga tao mahimo nila. So they are also included in the characteristics of the clients. We also have the people living with HIV or AIDS or kaning people nga kaning naay mga AIDS or naka-interact na sa mga taong naay HIV or AIDS. So like naa sila ma-feel nila nga kaning naa sila anxiety ba? Na sila anxiety nga ma-feel when it comes to HIV and AIDS. So they need counseling and it is also included in the characteristics as a client. So that's it, and thank you for listening. I am Shine Marjoline Hementiza again from Group 1.
So we are going to talk about settings in counseling. So what comes on your mind when you hear settings in counseling? So this includes private practice, community settings, the legal system, group homes, long-term care facilities, short-term care facilities, in advocacy roles, and in the educational system. In each setting, different skills and training are required. So, the physical area itself is designed to be neutral and distraction-free so that the client and their issues can take center stage. To create a relaxing atmosphere, soft lighting and peaceful hues are popular alternatives. The placement of the chairs, whether facing one another or angled to promote teamwork, is thoughtfully chosen to enhance communication. Counseling environments go beyond physical location. With the rise and popularity of virtual counseling platforms, patients can now go therapy in the convenience of their own homes. This flexibility is especially helpful for people who have trouble moving about, or for people who need therapy in remote areas. Counseling environments, atmosphere, and therapy styles are closely related. A secure and accepting environment is facilitated by the counselor's kind and understanding demeanor. Clients are encouraged to express their thoughts and feelings honestly because of this, as well as the assurance of secrecy provided by these environments. Must be culturally competent, and in addition to having both physical and virtual venues, therapists work hard to establish a welcoming atmosphere that values and recognizes people from all origins. Informational resources, culturally appropriate decor, and an understanding of different cultures all help to create a setting where clients feel seen and understood. Counseling is carefully designed to facilitate emotionally safety, trust, and productive conversation. This creates a space where people may explore and manage their ideas and feelings with guidance of qualified experts. Additionally, I will describe the setting in counselings. So there are government setting, private sector settings, society settings, community settings, and school settings. There are five settings in counseling. So government setting. Work with the various government agencies that have counseling services such as social welfare, correctional department, the court system, child and women affairs services, military, police, hospitals, foster homes, and rehabilitation center. Also, private sector setting, counselor range from the independent provides of services or work for NGOs or specialized profit centers and organizations that render a variety of counseling service. Civil society settings. The context of civil society is generally characterized are non-profit and issue-based centers or organizations such as for abused women, abandoned children, and elderly veterans, teachers, professionals, or religious groups. So, community setting has the greatest and widest application of counseling services considering the diversity of people. There are people who are in conflict with the law, socially marginalized people who suffer loss of all kind, those living in institutional homes, and those experiencing different life transitions. Also, school setting. Lastly, school setting. In the school setting, the role of school counselor is more complex since needs of the students can vary widely. So, counselors work in various settings, from government to private sectors to civil society school setting, drawing on a wide range of processes, methods, and tools. Counselors are trained to use what is appropriate for the setting and relative to their specialty. There are classical approaches informed by theories of counseling that scaffold their process and selection of methods and tools. That's all for setting counseling. Thank you.
Hi everyone, I am Zurame Jilape, and today I will talk about the processes in counseling. What is counseling processes? It means that you are sharing, or you being a counselor will express your concerns to the client, and which this help the client more effectively. Therapeutic alliance. This refers to the quality of the relationship between the counselor and the client, which is ang client na siya trust sa counselor about talking her or his feelings more, and then na sila pagka-strong bond sa ilang duha, like na sila trust, empathy, and mutual respect, especially sa counselor na adyo na sila mutual respect sa client nila. Communication. Actually, ang communication is which is kanang naga-communicate ka sa imong client in respectful way or like friendly nga murag vibe nimo siya, like para dili nimo siya mailhan nga you're just being concerned to her or his, like that. Tapos dapat murag na siya napud kay understanding siya. Goal setting. Collaboratively setting goals is an important process in counseling. Establishing clear and achievable objectives helps guide the counseling process and provides framework for measuring progress. Murag ang tawag ani kay like gina-clear and ang mga objectives like mga guides nila sa counselor. Tapos ang assessment and diagnosis is the counselor assesses the client's situation, identifies issues, and necessary makes a diagnosis. This process helps in understanding clients' needs and tailoring interventions accordingly, which is like kanang ang murag imong pagkabalo sa client sa like yung situation unsa yang na feel, and then murag kana yung issue kay murag ma-identify nimo ang issue niya, which is very important ana og mag-counseling ka, and then mag-make sa diagnosis para sila. Exploration and insight. Counseling often involves exploring thoughts, feelings, and behaviors to gain insight into the client's experiences. This process can lead to increased self-awareness and a better understanding of underlying issues. So, ang kanin daw kay murag gina-explore nimo ang mga thoughts, feelings, and behaviors nga gina-gain sa client so that kanang para ma-increase sad ilang mga self-awareness, tapos para napud sila pagka better understanding sa ilang mga emotions, like kung mag-talk ang counselor sa ila napud sila murag ma-feel nga self-awareness para sa ingana. Interventions and techniques. Counselors use various therapeutic interventions and techniques to address the client's concerns. These can include cognitive behavioral techniques, physics education, role playing, and other approaches tailored to the client's needs. So murag various therapeutic interventions nga makapaano sa client, like mga concerns nila nga pwede na to sila maanos, like role playing and other approaches tailored to the client's needs. So kung unsay gusto sa client, like mga gusto niya ipang share nga na. Feedback and reflection. Both the counselor and the client provide feedback during sessions, reflecting on experiences and discussing progress or challenge contributes to the ongoing therapeutic process. So ang both counselor and client kay murag feedback sila pud silang mga pang-ingon, like during sa sessions nila na sila ginaingon pud silang sarili, like the counselor, they would give advice to the client for like murag mo na yang murag ma-share sa client, and then kanang murag gina-reflect niya ang experiences sa client, which is very important kay mauna ang para ma-process nimo imong sarili. Like termination and closure. Bringing the counseling process to a close is essential part of therapy. It involves summarizing progress, reviewing goals, and discussing strategies for maintaining positive changes. So ang termination and closure kay murag dala sila og murag close sa essential part sa therapy, like murag gina-summarize nilang mga progress ay nga na, and then murag gina-review sa nila ilang mga goals, and murag tapos discussing about their strategies, like that. And that's all. Thank you.
Good day. My name is Salipod, one of the reporters of Week 4 and 5 in Diass. And today, this video reporting is the adjoining topic of the counseling, entitled The Tools and Methods in Counseling. So before we dig in to the topic, let us know kung unsa jud ang unsa ning tools and methods in counseling, kung unsa na siya. A counselor uses a variety of assessment tools and techniques to help his or her clients. These tools can be used either during the assessment phase or the process of intervention. So, ang kaning tools and methods, these are the techniques of a counselor that they uses to their clients to help them na mas maayo o mas nindot ang ilahang ang pag-guide nila sa counseling. So they use techniques and tools, method in order for them to help their clients. And these tools can be used either during the assessment phase or the process of intervention. They can be either non-standardized or standardized. We will, in the next pages or the next slide, we will talk about and we will know kung unsa ng non-standardized and standardized. Both type of techniques are used in counseling primary data. So to differentiate the non-standardized techniques and standardized techniques in counseling, the non-standardized techniques are the case study, interview, rating scales, questionnaire, observation, sociometry, biography, cumulated record, and anecdotal records. These are the tools, or yes, the tools that the counselors use that focuses on the subjective experiences of their clients. So, mura siya og kanang assessment or tools for them to identify the case or the situation of their clients. That is non-standardized techniques. So there are 9 non-standardized techniques in counseling. The first is the questionnaire. A questionnaire is a set of questions given to individuals or groups to gather information about conditions and practices they are presumed to know. Questions can be open-ended or closed-ended, with the latter requiring a limited yes or no answers. So, ang questionnaire daw, it is one of the tools used by the counselors to counselor used to assess or to know what is the problem, or to identify the problem of their client. A questionnaire is a set of questions, of course, given to individuals or groups to gather information about the condition and practices they are presumed to know. Questions can be open-ended or closed-ended, with the latter of requiring a limited yes or no answer. So, in the questionnaire in counseling, ang mga questions lang siya, ang mga question lang nga naa sa questionnaire is kanang answerable lang siya between yes or no for easy answer sa client. For them, it is a tool for a counselor to identify what is the problem and to identify how would they deal a kind of problem, or what are they gonna do about a situation of the clients. Another part of the non-standardized techniques is the observation. This is used by professional counselors to study behavior. Its effectiveness depends on the skill of the practitioner. Counselors are expected to observe well-defined behavior without biases and prejudice. The usefulness of the observation depends on the manner and purpose for which they are conducted. So, ang observation, gini-use po din siya sa mga counselors. Counselors are expected to observe well-defined behavior without biases and prejudice. The usefulness of observation depends on the manner and purpose for which they are conducted. Ang kaning observation sa counseling, magdepend lang pud ang iyahang effectiveness sa isa ka skill sa practitioner. Kay ang observation kay dili man pud siya basta-basta good kay ang of course observation is all about kanang reading the kanang ang lihok, ginabasa nimo ang lihok sa imong patient, ginabasa nimo kung how siya magstorya, how siya gina-express niya ang iyang thoughts about sa iyang problem. That is all about observation in counseling. Another tool under the non-standardized is sociometry. It is used to study the social relationship of individuals within a group and can also identify personality problems. It is a valuable source of information in assessing the social behavior of an individual. So, sociometry is used by a counselor na gina-identify niya kung giunsa pag-affect sa relationship sa ilahang gina-counsel or sa ilahang patient, kung giunsa pag-affect ang relationship ato sa ilahang patient with other people. It's either in a relationship of individuals or within a group. Kung giunsa to pag-affect ang relationship sa ilahang patient. And i-identify nila and this sociometry can also identify personality problems. It is a valuable source of information in assessing the social behavior of individuals. And ang kaning sociometry, it is also a valuable source of information because by this na-identify nila ang social behavior of a person. Kay it is because through this ma-identify nila ang connection o kung unsa ang effect unsa ilang epekto ani sa usa ka person. The fourth non-standardized technique is the autobiography. It is a technique used in counseling to gather valuable information about an individual's interest, abilities, personal history, hopes, and ambitions, likes and dislikes. The individual is given structured autobiographical items to write out in their own words. Ang autobiography, it is also a tool that is used by the counselors to gather information information of their patients. Gather valuable information about an individual's interest, abilities, their personal history, hopes, ambitions, likes, and dislikes. The individual is given structured autobiography items to write down in their own words. So, autobiography is used by the counselors to identify kung unsa ang mga hilig, kung kinsa o kung unsa ang ilang gina-counsel or ilang patient. But autobiography is written also by the patient itself. Ang patient ang musulat sa ilang autobiography. This information is then verified by various other means. Autobiography is considered the best techniques for appraising feelings, values, and attitudes as they are immeasurable by other tools. Nga nung mamag-istorya man sila, nga makaingon man, nga best technique for appraising feelings, values, and attitudes ang kaning autobiography. It is, I think it is because autobiography, nagstorya man gud siya kung kinsa o kung unsa na ang imuhang patient and sila mismo, ang patient mismo ang ingon or ang nag-describe sa ilang self kung kinsa sila. That's what the autobiography makes it different and unique from the other tools because dili siya pareha sa laing tools nga nagaistorya siya about sa bisan unsa pa man. This tool only focuses on kung kinsa jud ang tao, like ilahang patient, like kung silang pangalan, kung silang favorite, dili siya like nagaistorya siya, dili siya question nga nangutana nga kinsa man unsa may epekto ani nila, unsa may event. No, ano siya, nag-focus na siya sa gusto kinsa ug unsa ang naa or kung kinsa ang ilahang patient ug unsa ang pag-ila sa sarili sa ilahang patient. That's what makes autobiography in as tools in counseling unique. Next is the rating scale. Scales are used to determine the presence or absence of a behavior or trait. These characteristics are rated using a rating scale, which assigns a given number of points to each characteristics. So this means that rating scale is also a tool used by the counselors to determine the presence or absence of a behavior or trait sa ilahang gina-counsel or sa ilahang patients. This tool murag gina-know sa counselor if naabay absence sa behavior or trait ang ilahang patient or kanang i-determine pud nila by this tool ma-determine pud nila ang presence sa ilahang patient. May bawaan pud nila if naabay kanang murag kakulangan or murag kakulangan sa behavioral or sa trait sa ang ilahang patient. That is rating scale. That is a tool. That is one of a tool of a counselor used in counseling. Another tool under non-standardized is anecdotal record. An anecdotal record consists of a short, descriptive accounts about important events in a person's life. Each account is important. Each account is a report of a significant episode as deemed by the observer. The record is simple statement of the incident and its importance to the individual. So, ang anecdotal records, nag-consist na siya og short descriptive accounts about important events in a person's life. Gina-use ni siya sa mga counselors to record para mag-consist or mag-gather og information about sa mga or mag-gather og information, a short information or a short descriptive accounts about an important events in a person's life that may affect or kanang pwede siya mahimong reason about sa kanang or kanang ma-concerns or na-concern sa ilahang client karon nganong naabot lang point na kailangan og counsel. And each account is a report of a significant episode as seen by observer. The record is simple statement of an incident. A simple record lang siya, or a simple statement of the incident and its importance to the individual. Moving on to the next non-standardized, which is the case study. A case study is a comprehensive collection of information gathered using different tools and techniques. It is considered the best method for studying the whole person. In a case study, information about the individual is organized and combined into a whole, viewing the subject as someone dynamic who is trying to adjust to his or her environment. So, meaning a case study is a comprehensive collection of information gathered using different tools and techniques. So, it is still a gathering of information about their client, but it uses a different tools and techniques to gather information. And it is also considered the best method. Case study is considered as the best method for studying the whole person. And in a case study, information about individuals is organized and combined into a whole, viewing the subject as someone dynamic who is trying to adjust to his or her environment. So another non-standardized technique is the cumulated record. It is a record of information concerned with the appraisal of an individual student. So this kind of tool sa counseling is nag-focus siya sa mga students. The information collected periodically through various means is assembled in a summary for cumulative record. So, in this tool, it is used specifically sa mga students. This is to identify, to know the record sa ang mga experiences sa mga students and identify kung unsa man tong mga experiences sa students sa ilahang school in order for a counselor to help them and to guide them sa ilahang pag-eskwela. It is a method or a tool to identify things, experiences, like ang ilang mga behavior sa school, ang ilahang presence, ang ilahang mga attitudes, ang ilahang mga behavioral acts inside the classroom. It is the cumulated record. And the last but not the least part under this non-standardized tool in counseling is the interview. It aims to establish a friendly and informal relationship between the interviewer and the interviewee. This tool is used for various purposes such as introductory meetings, fact-finding, evaluations, information gathering, and providing a therapeutic environment for the client. This interviewee should be allowed to speak freely in a permissive atmosphere with confidence and freedom. Now, moving on to the, we are done with the non-standardized techniques. We are now moving on to the standardized techniques. Remember, the standardized techniques. It is a tool used in counseling that identifies the personalities, the interest of a person. Kung ang non-standardized, nag-focus siya atong mga previous nga ginapakita na ko nga examples ganiha sa tools. Ang kaning standardized, nag-focus na siya sa interest, sa intelligence, and sa usa ka person. Yes, a specific person. It is a tool to identify those sa usa ka tao. And an example of the standardized technique is the aptitude test. It is used to measure an individual's ability to perform a specific task or acquire the necessary knowledge in a given area. It assumes that individuals have a natural ability that can be developed through education or training. However, aptitude has its limits and cannot be expanded beyond a certain point. So, ang kaning aptitude test, muna siya ang gina-used to measure individuals' ability. It is a tool to measure an individual's ability to perform a specific task or acquire the necessary knowledge in a given area. And it assumes that individuals have natural ability that can be developed through education or training. Another standardized technique is the achievement test. It is the use of tests to measure learning levels and grades, as well as strengths and weaknesses in a subject area. So, ang kaning nga tool, ginagamit ni siya to test and measure the learning levels and grades, as well as the strength and weaknesses in a subject area of a person. These tests are widely used due to simplicity and ease in identifying correct context measures. So, it is helpful in counseling this because it tests to measure learning levels and rates, diba? And as well as the strength and the weaknesses of a person. The third one is the interest inventory. An interest is an attitude towards objects, activities, or experiences that reflects what we find appealing or unappealing. So this tool is also to identify or to know the interest towards an object. Yes, we all know that interest is an attitude towards objects, activities, or experiences that reflects what we find appealing or unappealing. An interest inventory helps individuals, it identifies and clarify their interest in relation to different courses and careers. And it is also assist it assists in choosing a job and shaping experiences that align with their experiences or with their interest. And the last one for under standardized um, techniques is the personality. Personality encompasses an individual's physical, socio-emotional, and personal characteristics, making it the sum total of their behavior in social situations. Personality tests are conducted to help individuals resolve emotional conflicts. So, this personality, it is a tool to help them, to help individuals or a counselee or a patient of a counselor to test and help them to help an individuals resolve emotional conflicts and also help them to handle and how they should be handling their emotions and controlling their emotions when yes when having a emotional conflicts or kanang murag paglibog sa utok or paglibog sa imong emotion nga wala ka kasabot kung saan bation or kung unsa naman ang dagan. This personality test helps to resolve them and gives answer on how you should address and kung unsaon jud siya pag control sa imong emotional conflicts. So we are done with the tools in counseling. Moving on to the methods in counseling. So when we say methods in counseling, it refers to the various therapeutic techniques and approaches used by counselors to help clients address their concerns, explore their thoughts and emotions, and work towards personal growth and positive change. These methods are tailored to the specific needs and goals of each individual client. So if ang tool murag sila og kanang from the word tool mo siya og kanang mga techniques or mga tool, mga gamit nila, mga way nila on identifying or mga way nila on how they help their clients. While ang method, process jud siya as in kanang process jud siya in counseling in which it is used by counselors to help their clients address their concerns and explore their thoughts and emotion and work towards personal growth and gives or provide a positive change. So I have here an eight methods in counseling. The first one is the cognitive behavioral therapy or CBT, and the second one is psychodynamic therapy, and the third one is humanistic therapy. So in the cognitive behavioral therapy or CBT, it helps clients identify and change negative thought patterns and behaviors that contribute to emotional distress, and it focuses on developing healthier ways of thinking and coping with challenges. So in cognitive behavioral therapy, nag-help ni siya this theory or therapy or method, nag-help ni siya sa mga clients mga ma-identify ug ma-change ang ilahang negative thoughts and patterns and behavior nga nag-contribute og mga emotional distress nga and nag-focus ni siya to develop and to develop healthier ways of thinking and coping with challenges. So cognitive behavioral, nag-identify na siya og mga negative thoughts, and ginatuduan or kanang murag ginahatagan ta nila or kaning cognitive behavioral nga murag ang goal nila is to develop a healthier ways or mahimong imbes na full ka og negative, napuno ka og negativity, you are drawn by the negative thoughts of yours. Ang kaning cognitive behavioral therapy, it will help you to develop healthier ways of thinking and coping with challenges. Next is the psychodynamic therapy. This approach explores unconscious process and unresolved conflicts that influence a client's thoughts, emotions, and behaviors. So, ang kaning psychodynamic therapy, nag-explore niya sa mga unconscious process nga kanang mga unresolved problems nga mag-result siya or problems or conflicts nga nag-result siya sa imuhang emotions. Naghatag siya og negativity, naghatag siya bad influence, naghatag siya og negative impact sa imuha. Not only in your emotional but also in your mental health. In this therapy or in this method, it aims to increase self-awareness and understanding of underlying issues. So, from the word aims to increase self-awareness. This method will help you to understand any issues or conflicts nga naka-affect sa imong thoughts nga maghatag siya way to think to give you a way na how to think positively amidst of a conflict sa imong life, or bisan pa og kanang you are in the middle of conflict or something like nagabother sa imong self. Ang kani nga method murag tabangan kaniya na masatagan ka og way more positive to think about the situation para dili siya mag-worsen. And the third method is the humanistic therapy. Humanistic approaches like person-centered therapy emphasize a client's capacity for growth and self-actualization. The therapist provides empathy, unconditional positive regard, and genuineness to create a supportive environment. So in humanistic therapy, murag naghatag siya og kanaganing it's like a method or a therapy nga or approach na person-centered therapy, or naghatag siya og murag ganing nagapa-feel sa imong nga therapy nga you are not dili lang ikaw isa, you are not alone. If you are you are facing a battle or you are in the middle of kanang conflict or hardship sa imong life, this therapy kanang naghatag siya og kanang self-actualization, naghatag siya og capacity for growth and self-actualization. And this therapy also, ang counselors nagaprovide siya og empathy, unconditional positive regard, and genuineness to create a supportive environment. So more ginapa-feel nga you're not the one, you're not lonely, dili lang ikaw isa. Nga ginapa-feel sa imo nga even if you feel kanang ikaw lang isa, mingaw, lonely, this therapy or method will give you or provide you a supportive environment. The fourth method in counseling is the solution focused brief therapy or SFBT. SFBT helps client identify and build on their strengths and resources to find solutions to their problems. It emphasizes goal setting, exploring exceptions to the problem, and promoting small steps towards change. Similar lang gihapon siya sa past nga ay katong sa ika-third nga method nga nagapromote gihapon siya o kanang murag mag-goal setting. I think the third or the second kanang method or therapy, but na-discuss na murag similar lang sila nga murag naghatag siya ang kaning therapy naghatag siya og solutions to your problem in order to achieve a in order to achieve or kanang nakay ma-achieve sa imong life nga small improvements or small steps towards change after a miserable or being stuck in a miserable life or kanang miserable or kanang chaos or very traumatic man nga experience sa life. Next, the fifth therapy or method is the narrative therapy. Narrative therapy views individuals as the authors of their own stories. It helps clients examine and reframe their life narratives, empowering them to make positive changes and develop new perspective. So in this therapy or in this method, ang kaninga therapy, it views individuals as the authors of their own stories. It helps the clients to examine and reframe their life narratives and empowering them to make positive changes and develop new perspectives. Bali ang kaninga therapy, mura gina-improve lang gyapon nila ang imuhang self. Sa atong life, ang atong mga perspectives, ang atong mga gitang buhat sa atong life, atong mga decisions, dili man pud lang siya puro bad. Maybe sa life, mas feeling na to na mas lamang ang mga negatives, yes, mga negatives or ang mga dili makaya or maayo or dili siya in line sa dapat nga ma-meet ni mga standards sa imong life. Pero, by the help of, yes, it's normal, it's natural na jud na sa life, but by the help of this therapy or method, it will help clients or help people examine and reframe their life narratives and empowering them to make positive changes and develop new perspective. The sixth therapy or method in counseling that could help individuals is the family system therapy. This approach considers the family as a whole system and examines how family dynamics contribute to individual issues. This therapy, I think everyone needs this therapy or these methods. Kinahanglan nila I think kailangan ni ma-apply. Not dili man siya as in murag sa katibukan, pero ni uban jud. Kay we all know nga most of sa panahon karon based on my observation and yung mga family nga kanang need na to, murag kailangan pa na to og deeper knowledge to understand each other. And yes, family system therapy, this approach considers the family as a whole system and examines how family dynamics contribute to individual issues. It aims to improve communication, resolve conflicts, and strengthen family relationship. So in this therapy, ang iyahang goal or iyahang aims is to improve communication and resolve conflicts to strengthen family relationship. So by this therapy, murang ginahatagan mo ni a way or teach you, gina-guide, or gina-improve nila on how to communicate, to resolve, and how to communicate, how important is communication in the family, how to resolve conflicts, and to strengthen your family relationship. That is the goal and aim of this therapy. So the seventh method or therapy in counseling will be the Gestalt therapy. Gestalt therapy focuses on the present moment and emphasizes self-awareness and professional responsibility. It helps clients integrate their thoughts, feelings, and behaviors to achieve personal growth and self-acceptance. So, most of us in this generation or in this century, we always feel na we're gina-invalidate na to atong self or gina-question na to ang gina-question na to tong self. And wala tay self-acceptance nga murag na-apply sa atong self, which is naglack karon mostly sa mga tao, especially sa mga kabatanunan. This Gestalt therapy, nag-focus na siya and it emphasizes self-awareness and personal responsibilities. It helps clients to integrate their thoughts, feelings, and behaviors to achieve personal growth. To grow, this therapy aims you aims an individual to grow and to have a self-acceptance. And the last but not the least therapy or method in counseling is the mindfulness-based approaches. These approaches like mindfulness-based stress reduction or MBSR use mindfulness practices to cultivate present moment awareness and reduce stress. This help clients develop non-judgmental acceptance and enhance self-regulation. So in this method, like stress reduction, use mindfulness practice to cultivate present moment awareness and reduce stress. So this therapy or this method will use that kanang to ease your to ease your stress and reduce your stress, to develop non-judgmental acceptance and enhance self-regulation. So that is all the tools and the methods in counseling. I hope that ako ang naistorya or nag-discussed here sa lesson is dili man siya kanang as in maujud ang methods o ang tools. I'm not really sure, but I hope that kanang na-fulfill gihapon ako siya or napunan gihapon ako siya or na-provide gihapon ako siya ang mga information under sa tool and methods in counseling. That's all, and God bless.
Good day. My report is all about identifying needs for counseling. My report is a very short because since it is a needs for counseling. So here we go. Identifying needs for counseling involves the process of assessing and understanding the specific areas or issues that individuals or groups require assistance with in order to improve their well-being and mental health. Here are some key points related to identifying needs for counseling. So first is needs assessment. Need assessments. Conducting a needs assessment is an essential step in identifying the needs of individuals or communities. This assessment involves gathering data and information through various methods, such as surveys, interviews, and observation to determine the specific areas where counseling support is required. Second, the guiding question and goals. Counselors begin the needs assessment process by formulating specific guiding questions and goals. These questions and goals help direct the assessment and focus on understanding the unique needs and challenges of the individuals or group being assessed. Third needs is information gathering. Counselors carefully listen and gather information about the client's situation, including their personal, work, home, and education life. This information helps in identifying triggers, environmental factors, stress levels, and other contributing factors that may be influencing the individual's well-being. The fourth one is client-counselor interaction. Counseling sessions provide an opportunity for the therapists and clients to establish a relationship and discuss the issues that have led them to seek counseling. Each session is tailored to the client's specific challenges and treatment style, allowing the counselor to better understand their needs. And the last one is personal growth and needs. Identify, Identifying personal needs is also an important aspect of counseling. Clients are encouraged to reflect on their needs for love and security, competence, control, and positive emotions, among others, to gain a deeper understanding of their own well-being and growth. By identifying the specific needs of individuals or groups, counselor can tailor their approach and interventions to address those needs effectively, providing support and guidance to promote positive change and well-being.